Good morning, colleagues. Bongisa, I know it's 11:59. Perhaps we can wait another 2 minutes just to allow some people to log in.
I think most of the people that have shown interest are already here, a large portion of them. So I think we are like on due course. We are on time, all of us.
Okay, cool. Thank you very much, colleagues, for joining us at this press conference. My name is Siviwe Gwachube. I am the spokesperson for health in the Democratic Alliance in Parliament. And I'm joined here by the Democratic Alliance Chief Whip, Natasha Mazzoni, and also the Deputy Shadow Minister of Health, Lindy Wilson. And so we are going to take you through a statement which will be obviously issued as soon as we are done with the press conference. The statement will be a summation essentially of what we take you through here today, but also a document which we have compiled, which is what we will be mainly working through during this press conference. So that will be issued as soon as we are done here. Bongisa, who is our press officer, will, after we've gone through the different sections of the document, will then coordinate the question and answer session and effectively, sort of read through the chat if you want to ask questions via the chat, or he will then coordinate taking questions from each and every one of you who have joined in. The purpose of this press conference really is to highlight three parts of what has transpired. Firstly, it is an analysis of how we have fared as a country during the past 6 months. We first had our case, the first case of COVID-19, which was confirmed on the 5th of March. Which coincided with the DA's call for a debate of public importance on the matter. And it will essentially be an analysis of how we have fared as a country in this crisis. Also, it will speak to some of the key challenges that we saw when we undertook a DA national tour around the country of various health facilities, be it hospitals or primary healthcare facilities, quarantine facilities, or whatever that those may be. And also then the Chief Whip will talk to us through what we have done to address the issue of COVID corruption in Parliament. And that she will then highlight some of the action steps that we have called for in Parliament for this matter to be held, for the executive to be held accountable for some of these things. And then I will speak to the issue of the National Health Insurance, the National Health Insurance Bill, which is now resuming its processes back in Parliament in the next coming weeks. And then we will conclude and then open up the discussion for questions. Lindy?
Thank you, Siviwe. Okay, so as Siviwe said, it's been 6 months since South Africa confirmed its first COVID-19 case on the 5th of March, which, as we know, was an imported case. Since then, we have lost 15,000 people in this pandemic, and we've had over 600,000 confirmed cases of people who have been infected. Many amongst these are healthcare workers who have fought valiantly and amazingly against this global health crisis. And to all of them, we remain deeply indebted. In addition, though, we witnessed unprecedented economic devastation in South Africa. And this was witnessed yesterday with the news of a 51% GDP contraction. This has had a direct impact on South Africans' lives and their livelihoods. The past 6 months have been difficult in many ways. And there's so difficult that we cannot truly quantify it. This time has also widened the cracks in the South African health system, which have been festering under the surface, and has turned these cracks into gaping gaps of deep, deep inequality.
Thank you, Lindy. Colleagues, this time has been very instrumental in this lawmaking process that we are now about to begin on. The DA has been very clear that along with global trends, South Africa needs to move towards a universal health system, which will bridge the gaps between those who have and those who have not, but also critically bring dignity to the people of the country through the provision of affordable and quality healthcare. That's why we have been vehemently opposed to the National Health Insurance Bill in Parliament. It is our contention that this bill will achieve the opposite of what is needed in our country. This pandemic has proven exactly that. From March, it became very clear that our health system is fundamentally broken and would battle to deal with the pandemic. And it clearly did. We lost lives where many could have been saved. We had cluster outbreaks in health facilities that had poor infection control mechanisms due to overcrowding, and provincial health systems buckled under the pressure, while many politically connected individuals took the opportunity to loot public money, which you are all aware of. While the numbers of infections have been on a downward trend, it is now key to provide an objective assessment of how South Africa has fared in the face of this crisis. We need to use these lessons from this pandemic to now craft a way forward that will afford citizens better healthcare. That's why we undertook to conduct a national oversight tour, visiting all our provinces in order for us to see for ourselves where the weak links of our system were. This is important for lawmakers so that we can make sure that we legislate with credibility and not only from the Houses of Parliament. And that's why we undertook this provincial oversight visit.
Okay, so the Portfolio Committee did conduct limited oversights during this time. It was important, though, to visit even some of the most remote parts of our country, from Mount Aleph in the rural Eastern Cape to Berkeley West in the Northern Cape. It was also key and very important to attend the hardest hit areas of the Western Cape, Gauteng, and KwaZulu-Natal. In total, the DA national team visited 26 health facilities across the country, which were a combination of tertiary, regional, and district hospitals, primary healthcare facilities, mental health facilities, field hospitals, and quarantine facilities. This excludes the work that was done by the DA's provincial health spokespeople. During these visits, we encountered common themes, which are critical in the work that we now need to do in Parliament in legislation for a universal health care. There were 8 common themes which were recurring during all of these visits, and these were chronic staff shortages, very chronic staff shortages, poor and outdated infrastructure, which contributed to very poor infection control, inadequate bed capacity, inadequate ICU facilities, and in some cases, no ICU facilities at all. Poorly spread out provision of services within districts, which mean that patients need to travel hundreds of kilometers to get access to emergency care. Inadequate emergency medical personnel or EMS services in many of the provinces. Poor administrative and political leadership in many of the provinces, which became a critical part in the response to the COVID-19 pandemic. Rogue political heads who both misunderstand and disrespect the work of Parliament, which is to exercise oversight. And this was demonstrated by the blocking of MPs and MPLs in KwaZulu-Natal by their MEC. It is important to note, though, and we must keep this in mind, that despite the massive challenges, we encountered really dedicated healthcare workers who were subjected to untenable working conditions. Many of the issues our citizens face with healthcare professionals are due to factors beyond their control, many of which I have just mentioned.
Natasha.
Thank you, Siviwe, and thank you, Lindy, and thank you for the amazing oversight work that you have done on behalf of all South Africans. It is most appreciated. I think that we need to realize that while the country was contending with this global pandemic and emergency procurement processes were in place, there were those who took the opportunity to rob the public purse and use their political connections shamelessly. Money lost or misappropriated due to corruption or irregular tender processes is estimated at 5 billion rand. This money could have gone into our COVID-19 response efforts, but was feasted on by the corrupt and political elite. What parasites! Well, investigations have been initiated and law enforcement agencies must still have to yield very little results and virtually no recuperation of this money if there's no political will to prosecute guilty politicians in particular. We have to admit that we've seen this movie before. High-ranking officials are scapegoated and guilty ANC politicians play musical chairs and are rewarded with seats in parliament and legislatures or even worse, ministerial postings. Just to give you an example, I'd like to highlight what we found in Gauteng. 4.5 million rand was paid to companies that did not supply any goods. 5 million rand was paid to companies to deliver PPE, even though the department had no contracts with them. 12 million rand worth of goods was delivered before the issue of purchase orders were made. 82 million rands worth of goods were ordered from companies that were not registered with Treasury's Central Supply Database. 239 million worth of goods and services were ordered from companies that were non-tax compliant and whose bank accounts had not been verified. Last week, the Auditor General published a report in which he stated that 500 billion rand of COVID-19 relief funds that were prioritized were misappropriated and essentially stolen. Key areas of concern included the TERS benefit funding, the 350 rand social relief grant, the monthly fund, the 350 rand monthly fund, the Farmers Relief Fund, the Sports and Arts and Agriculture Relief Fund, the Industrial Development Corporation loan, and PPE procurement. Now, this theft has made international headlines as the most brazen abuse of power. The whole world is looking at us, and the whole world is quite rightly outraged, as so should we all be. That is why the DA has yet again called for a debate of national importance from the Speaker of the National Assembly, Thandi Modise, in order for Parliament to assert its oversight role in this matter. We await the Speaker's confirmation for the date and time of such a debate, and we thank Siviwe for having taken this on at the beginning of the crisis when she called for the initial COVID debate of national importance. Many political figures who sit in the benches of Parliament will have a lot to answer for in this regard, including President Cyril Ramaphosa for his son's involvement, and key ANC figures such as Ace Makashule, Nomvula Mokunyala, Bandile Masuku, and Kusela Diko. In addition to this, the DA has called for the ad hoc committee to be convened that will deal with matters of oversight during this period in order for Parliament to rightfully have the right to exercise its oversight on the executive functions. These corruption allegations have reaffirmed the need for such a committee, and we are very grateful that the Speaker has acknowledged that recent developments have shown that there is an absolute need for such kind of accountability. Finally, the DA leader and various portfolio heads have asked critical questions from their counterparts in government and have never neglected this important function over the last 6 months. We have been the only party that has been consistent in holding the government to account while providing workable solutions.
Thank you, Natasha. So colleagues, as you're aware, we had to put a pause on the NHI legislation process in Parliament since the last of the public hearings. The NHI public hearings were concluded in February this year, before the outbreak of the global pandemic. This process then was suspended as Parliament migrated to the new way of conducting its business. In the next coming weeks, though, we will be resuming the process on this legislation. And while we've noted the deliberate rushing of the process by the ANC in Parliament, we are committed to ensuring that we conduct this work deliberately and thoroughly. During the public hearings, this is some of the information that we have received from the parliamentary administration. During the public hearings across the 9 provinces, the committee heard and received 961 submissions from just over 11,000 attendees to these meetings. And we've stated before that there were many problems with the public participation process in Parliament during these public hearings. And that is a matter that we've obviously noted in this process. This information was compiled by Parliament and will require now the committee to scrutinize it over the coming weeks. In addition to this, Parliament has received over 64,000 written submissions. These now are the ones that they've acknowledged and they've counted in response to both the advert, and these have been submissions which were either hand-delivered or emailed. You will recall that the DA had run its own parallel process where we encouraged members of the public to submit their objections or their views on the bill more generally. And we collated these submissions and we submitted it on their behalf to Parliament. So it will include the thousands of submissions that the DA had handed over on behalf of South Africans and who had made use of our online portal. Now, colleagues, the next phase of this legislation process is to process, to hear, and to consider oral submissions from the various entities that have taken part in the process. We now know that there are 121 entities who have indicated their intention to deliver oral submissions to Parliament, a process that the committee now has to decide on. And this is a discussion that we have had with the committee last week. These entities include trade unions, they include hospital groups, they include medical schemes, academics, and industry experts. It is important at this point to note that we have had initial discussions with the committee about what is the best process to follow in looking and going through some of these submissions. And now that process is ongoing. Parliament has made the case for an independent entity to assist the committee in processing these submissions, both oral and written, in order for the process to be efficient. The terms of reference for the service provider are yet to be decided on, and this is the process that I was referring to when I was saying that this is still in discussion with parties and their respective leaders. Now, the DA is committed to ensuring that this process is open, is transparent, and that it is fair. In addition, we will be ensuring that members of Parliament still must carry out their constitutional obligations of lawmaking. As such, these are the non-negotiables that we are pushing for in the committee. As stated, we had a meeting with the committee last week where we were considering the initial findings of the oral submissions that were given to us and also the written submissions that were sent through to the committee. However, we now need to make sure that at this next phase of the NHI processing system, we are thorough, because we know that there is political will and there is political pressure to push through this legislation, essentially in order for us to push through this legislation and push it over to the NCOP. But we believe that the NHI Bill is significant and it is a huge piece of legislation that will change the way in which healthcare is delivered in the country, and therefore we can't afford to falter in any way. We know that there's been times where Parliament has found to be wanting in its processes. And so we don't want this to be challengeable in a court of law. So, as I said, the DA is committed to ensuring that this process is open and transparent and fair. In addition, we will make sure that all our members, though, while serving on this committee and going through all of these submissions, are still fulfilling their obligations. So these are the non-negotiables that we will now be submitting to the committee chairperson and its members, that we will be submitting to the chair of chairs, Cedric Farlick, to make sure that these are not circumvented in any way. And we will make sure that this is also communicated through our chief whip, Natasha Mazzoni, to the Speaker of Parliament, to state that because of the importance of this legislation, these are the non-negotiables that we cannot in any way, shortchange the citizens of South Africa. We want to make sure that, one, the role of the external provider, service provider that is to be appointed, must only be limited to organizing the submissions and only conducting logistical support. It cannot be in any way that a substantive role that members of Parliament must play is replaced by this entity. And we need to make sure that members of Parliament are actively engaging with the views of the people of South Africa. We had seen during the Section 25 amendment process how an entity can also be questioned in its integrity, and we want to make sure that this does not happen here. While the tendering process and the selection and ultimate appointment of this entity is the function of Parliament, and we respect that because it's important that political players are not a part of this. However, as the DA members, we will make sure that we keep a close eye on the provider chosen, because this will have a direct impact on the objectivity and the integrity of the work that is done by the service provider. We know that there were reports the last time when this was done by a service provider during the Section 25 amendment process, where the service provider was said to have even provided a report back to the ANC before that report was submitted to Parliament. And so we want to make sure that this does not happen with this bill. And while the ANC in Parliament seeks to rush this process, the DA will be making a written submission, as I've stated, to the committee, to also the chair of chairs, Cedric Farlick, and to the Speaker of Parliament, that each presentation by an entity needs to be no less than 30 minutes and allow for 30 minutes engagement with the committee members. Colleagues, we have received hundreds of submissions, not only from members of the public, but also from entities who have a direct interest in this process. And some of them have submitted, documents as thick as 200 pages in which they go through in great detail, looking at a clause-by-clause analysis of the current bill in its current status. And so while there has been a desire to limit the presentations to 10 minutes, in order to cram as many entities as possible, we'll fight against this, because we believe that if we are being thorough with this process, then each entity must have adequate time to essentially present what their inputs are. And we as a committee, as lawmakers, need to have enough time for us to interrogate exactly what their inputs are, to ask the relevant questions, and then we need to deliberate on those. Because ultimately, this process must be underscored by transparency and fairness. The DA will support a hybrid system, which has been touted by Parliament in our last meeting last week, a hybrid system of engaging with stakeholders. We will support this because we believe it's important that we accommodate as many of the 121 organizations that have indicated they desire to take part in this process. Also because in line of how Parliament has been conducting its business, we think that it is correct, and we also think that it is actually effective to have these engagements with stakeholders on a hybrid system, either in person in Parliament or either through online mechanisms like we are doing now. In discussion with our party leadership, because this was now the decision that we had taken as a committee, that we will take this back and we will discuss it as parties on what is the best way forward. We will argue that the committee should dedicate Tuesdays and Wednesdays to this process. So Tuesdays and Wednesdays are usually committee days, and we believe that we should be able to use these 2 days to process these submissions in order to allow members again to still carry out their constitutional obligations in their constituencies. We don't believe in this notion that we need to push hearings for 7 days or 5 days a week in an attempt to push this bill through without any proper engagement. And it is our obligation as lawmakers to make sure that we are both present in Parliament, but also making sure that we pay particular attention to this bill, which really will have a great impact on our health system. Ultimately, we believe that the following must take place: that there needs to be a consideration by the members of Parliament of all the oral submissions that were obtained from the public. As I've stated above, there were thousands, and we went through with, relative success in most of the provinces to be able to obtain these public submissions. Parliament invested a lot of resources to make sure that we were supported in all the public hearings and that these oral submissions were captured. And so we need, firstly, time to consider all of them. We then also need time to consider the written submissions from the public. As Parliament has stated, there are thousands, hundreds of thousands of written submissions, either hand-delivered or written, which have been given to Parliament. And so we now need also time to go through each and every one of those submissions. And then we need an agreement on the terms of reference by the independent service provider. And then the rollout, then lastly, of the oral submission process by the various 121 entities. The reason why we need an agreement on the terms of reference, and we will not stop at fighting for these terms of reference, which I've stated above, is because, again, the function of the members of Parliament cannot be essentially replaced by an independent service provider. We are lawmakers, and when we ask people of South Africa to submit their views on a particular bill, which will have a direct impact on their lives, then we need to make sure that we apply ourselves to that process and that we don't necessarily outsource that to an entity that will summarize the inputs, but we go through the process. So as the Democratic Alliance, we committed to it. We committed to spending time on these submissions. We are also committed to spending our weekends where possible that don't conflict with constituency functions, to going through these submissions in great detail. But what we cannot have is some kind of shortchanging of the process. And so in conclusion, while the COVID-19 pandemic was an unavoidable health crisis that even some of the most advanced health systems in the world really battled with, we know that our health system was not ready for something of this nature. Should the status quo remain, so ultimately should the health system remain in the current form that it is in, the system will collapse for all South Africans, regardless of their socioeconomic status. Everybody will suffer, because whether you are part of the 80% of South Africans who rely on a broken health system, on a broken public health system, or the 16% of South Africans who rely on a hugely unaffordable private health system, this needs to change. And this is why we are committed to ensuring that the country enjoys a health system review. And we think that that is the process that we as members of Parliament need to take the lead in. We now have an opportunity. We've seen what a global pandemic can do to a weak health system. And therefore, now in our legislating making process, we need to make sure that we effectively change the way in which healthcare is delivered in the country. So what are the key things that the DA is going to push for in this legislating process? We want to make sure that we close the inequality gap, which inhibits access to quality services. So access is not a big problem in South Africa, but quality is. So we want to make sure that the quality of healthcare in the country is improved. Whether you're making use of private healthcare or public healthcare, you need to be afforded quality healthcare. We need to make sure that as members of parliament, we design a system that we allow for effective partnership between the private and the public health actors, like we saw during this pandemic. I think there are massive lessons here to be learned, colleagues, because if you look at how the public and the private health system collaborated during this time, where service level agreements were signed, and we shared services, whether it was expertise, whether it was essentially health infrastructure, we believe that that is a cornerstone of a functioning health system. And so in the current legislation, the relationship between private and public health system is underplayed. And we think that the lessons from this pandemic is that it actually should be augmented. Fourthly, we want to make sure as the DA that we give effect to the intention of the National Healthcare Act of 2003, which allows for national government to regulate the private healthcare sector in a way that will protect the consumer, and to make sure that the service that they get is of quality. We know that current legislation affords government to do that, and they've neglected to do so. We've seen that Competition Commission report, which speaks exactly to this. And so current legislation does afford national government to do this, and they've neglected to do so. So it is now no longer fair for national government to scapegoat the private health system to talk about pricing or to talk about over-servicing. But in fact, they've neglected their ability to responsibly regulate the private healthcare system to make sure that the two work hand in hand. We will push for to ensure that there are strong governance systems, that we allow for independence from political actors in order to root out corruption. Natasha spoke at length about the scourge of corruption that we saw during this time in South Africa, where emergency procurement processes were agreed upon because of the nature of a crisis. But when we are building a universal healthcare system in the current legislation, we need to make sure that governance systems are strong enough to make sure that they're independent from politicians, so that we don't have this rampant corruption that we saw during this time. And we know that the current version of the NHI Bill does not have this. It is completely, the antithesis of what good governance systems wish for. And then ultimately, we want to ensure that the dignity of South Africans is ensured in whatever health system that we agree to. So we are committed to this process, but we want to make sure that in Parliament, we push for thoroughness, we push for fairness, and we push for transparency. And ultimately, whatever is agreed to in the legislation that will come.
Colleagues, it seems that Savi was just for a second. She was finishing off. Bongisa is going to lead us in the questions and answer session from you, colleagues. So Bongisa, let me hand over to you, and if you can start us off with the questions and answers, please.
Thank you very much, Natasha. Colleagues, this is indeed an opportunity for you guys to give us any questions you might have. You can do so by raising your virtual hand. At the moment, I don't see any hands, and you are also welcome to send through your questions via the chat box. So we will begin with the first round of questions. Anyone with a question?
Of course, colleagues, a full copy of the statement will be released to you. Bongisa and the DA media staff have ensured that and will ensure, if you don't have a copy, that you will have a full copy.
Neo has a question, and I will unmute you now, Neo, so that you can ask your question.
Hi, Natasha. It's Neo from Jacaranda FM. Natasha, I'd just like to know concerning the people, the officials who are involved in this tender processes, how will you guys hold the president accountable and the likes of Masuku and other officials who are involved, like Esma Khashila's son? Do you think going through a public prosecuting system would help, or is the DA going to explore private prosecution? Because it seems like that's the only thing that works in the country.
No, that's an incredibly good question, and I think it is a sign of what is going fundamentally wrong in our country, that we don't really know which legal systems work the best. Certainly, we are looking at every possible avenue, and Siviwe and the rest of the health team have gathered as much information as they possibly can, which we are looking at with our legal teams too. Of course, one of the requirements with the South African legal system is that you exhaust all means possible before one approaches the courts directly. So Siviwe has ensured with her health team that we will have enough information to bring through to hold people accountable via the parliamentary processes. And then what we will be doing is keeping all our legal options open regarding how we hold those account. Of course, people that are members of parliament, we can hold accountable via the parliamentary channels, but those who are not members of parliament will then be held accountable via the legal channels available to all South Africans. So now I want you to know that this is something that we are dealing with very severely. We are absolutely taking no shortcuts here. We are throwing the full might of the law at those who have stolen the money of South Africans during this most desperate of times. Corruption at all times is unacceptable, but when people's lives have been lost because of this corruption, it becomes even more serious, and it causes us to act with more haste. So in the coming weeks, you will see Siviwe and her team taking unprecedented actions against those who are found to have been involved in corruption regarding the COVID-19 scandals, and the Democratic Alliance will certainly be taking unprecedented steps to hold those to account, be it through systems of parliament, be it through systems of the law, or private systems available to us as South Africans.
There's a question from Tamakant from the Business Day. It is directed at Siviwe. It says, if the Health Committee agrees to hear oral submissions on the NHI Bill on Tuesday and Wednesday, as you suggest, how long do you think it will take the committee to hear all the submissions? That is, when do you wrap that part of the process? And then there's another question on the chat from Christian Duplessis from Network 24. It is also to Siviwe. It says, why does the DA believe the NHI Bill will be detrimental to the health system?
Cool.
If you could.
Thank you very much, Bongisa. Tamar, yes, very important question about the scheduling of the deliberations. So our view is that, designing a universal healthcare system is urgent, and we are not in any way trying to make sure that this process takes longer than it should. But that needs to be balanced out with exactly what it is that we need to do as lawmakers. I am very frustrated with the notion that Parliament is increasingly becoming relegated to a rubber stamping process of policies and legislation that has been decided upon at Luthuli House. I think it is a complete undermining of the processes of Parliament and what Parliament stands for. The people of South Africa elect us to be leaders, to legislate on their behalf. And if we can't do that effectively, I have a problem with that. And so if we only choose Tuesdays and Wednesdays. Reason being that we know in our submission to the chairperson, we will suggest this is because Tuesdays and Wednesdays are generally committee days, and Thursdays are party caucuses days. And then Fridays, most of our members are traveling back to their constituencies, and it's constituency days, including Mondays. And so because this process has to take its course, we can't in any way essentially neglect our duties as members of parliament. There was even maybe a suggestion, which I thought maybe it was probably more of an elementary one or more of an initial suggestion, that somehow we need to spend all our weeks and not attend sittings of parliament. And now, having had this conversation with our chair, it's important to note that as members of parliament, our job is not to go to parliament and to go to the sittings of parliament just only to discuss health matters. We are there to vote on important bills. We are there to participate fully in the lawmaking process. And so what we are saying is that if we are going to be using Tuesdays and Wednesdays, it's very possible. Members of parliament and the members of the committee, we can begin the process from 8 o'clock to 1 o'clock, which is 5 hours for us to see effectively if our proposals are accepted, and we have 30 minutes for deliberations for the entities to present, and 30 minutes for us to essentially go through what they and to interrogate them on their submissions. That's an hour per entity. And we would, if we are designing the program, we would then allow for 15 minutes between each entity for us to deliberate and see what were the key takeaways from each entity. And so we believe 5 hours, 10 hours a week is enough for us to see a sizable amount of entities. Not all of them will want to take the full 30 minutes. And so we can always include more. But if we start this process as soon as possible, but again, systematically, because we still have to go through the oral submissions which were given to us by South Africans. And we also still need to decide on the terms of reference of the independent service provider. But once we get started with that process, which is touted between October and November, I think that we can go through until the early weeks of December before Parliament rises. We can, like we did this year, start our parliamentary program earlier in the year, in January, for us to essentially see each and every one of those 121 entities which have indicated that they want to take part in this process. We don't want to shortchange anybody, because these are industry experts, these are academics, these are groupings, these are hospital groups, these are medical aid schemes. And so I think there's valuable things to be obtained from some of those submissions that we need to take into account. And so I think it can take us a couple of months, Tamar, and we are happy with that. We are happy with that because, again, this is such a significant piece of legislation, and to shortchange it would be a disservice and, quite frankly, a dereliction of our duty as members of parliament. Then, Bongisa, the other question was around, sorry, please do remind me.
It was from NetVec24. It says, why does the DA believe the NHI bill will be detrimental to the health system?
Right. So as I stated before, I mean, we have done now the work of not only, having seen the health system before this COVID-19 pandemic hit, but I think the COVID-19 pandemic was such a crucial turning moment for us in this lawmaking process, because it illuminated and showed us distinctly what the problems of our health system are. As Lindy stated, we were able to identify 8 key themes around staff shortages, around the inadequacy of EMS, around the fact that, I mean, I visited Alfred Nzo the Alfred Nzo district, which is in Bizana. And in that entire district, the Eastern Cape had not a single critical care bed during this time. So that meant that people of Alfred Nzo had to get transport, obtain transport that would take them to Mthatha General Hospital, should they be critical patients, which is hundreds of kilometers away. And so I think that this COVID-19 pandemic is actually a great opportunity for this committee to see where the weaknesses are. And that's why we undertook the oversight visit across the country to go and see for ourselves where the weaknesses are. So the reason why the NHI bill is not going to aid this is really can be summarized in 3 ways. Number one, the NHI bill does not in any way, if you look at its formation, it does not in any way address the issue of quality healthcare. It is more about a funding of healthcare and how do you fund healthcare in the country. Now, our view is that you've got to be able to fund healthcare, but also make sure that quality is embedded in it. Because colleagues, a lot of South Africans will tell you that they are able to access quality health, they are able to access healthcare in many parts of the country. But is it of quality? No, most certainly not. And so the bill does not talk about how do we invest in the current healthcare infrastructure so that we can make sure whether you use private or public healthcare system, you are also afforded the very same quality that anybody else is. Universal healthcare principles underline the fact that it's important to not only have access, but to have access to quality. And in this country, we don't have quality healthcare to people. So that's the first problem that we believe is the problem, that it doesn't underscore or talk about investing in the current health system so that we can achieve quality. The big problem, Natasha spoke about this at length, the big problem also is about the fact that there will be an establishment of yet another state-owned enterprise, yet another state-owned entity that will essentially be responsible for hundreds of billions of public money. Now, we know what has happened to public money in this country. We saw in state capture on what is being discovered there. We also have seen most recently during this COVID crisis, actually, which is more relevant to this process, that essentially that when you are having emergency procurement processes and you have got essentially a centralized fund, you are likely to have a situation where you are going to have people who will steal. The fact that the National Health Insurance speaks not about how governance will work with that health system, with that health fund, is a big problem. And so that's the second problem, that we're not going to be able to fix the governance problems, and we're going to have rampant looting. And here's the difference between looting the SABC and looting a public healthcare fund. If you loot the SABC, of course, it's a massive problem. But if you loot money that is intended to give quality healthcare to South Africans, we have a big problem that is a matter of life and death. And then lastly, as I said, so it's the issues of quality that we are really against. The issues of not embedding good governance principles in the model itself. And then lastly, there's something really missing. And again, the COVID-19 pandemic really underscored this: the collaboration between private and public healthcare systems. What the NHI bill identifies as a problem statement is that the problem is private healthcare is unaffordable and it's only for 16% of South Africans. That's very true. But why don't we, in designing a universal healthcare system, work with the two? Make sure that we do what we did. We managed out of a crisis to be able to work with both the private and the public healthcare system to merge the two, to bring about quality healthcare that was needed at the time. And so if we've got an opportunity to redesign our health system, let's make sure that the model incorporates that instead of essentially just suppressing the one over another.
We have a question from Riante from E-News. She says, what key areas within the healthcare system do you say need to be bolstered or urgently improved if we are to cope with the second wave of the COVID-19? And another one is from Lindsay Plankinger from ENCA. If you fear that Parliament will be looking to rush through the passing of the NHI Bill, do you...
Sorry, colleagues, we seem to have a problem with Bungisa's sound. So I'll just read the follow-up questions. We had a question from Riante from ETV News. She's asking, what key areas within the healthcare system do you say need to be bolstered urgently or improved if we're to cope with a second wave? And then a question from Lindsay Dendlinger from ENCA. She's asking, if you fear that Parliament will be looking to rush through the passing of the NHI Bill, how do you respond to possible criticism that you are purposefully delaying its passage by insisting on longer presentations? I'll give over to you to answer those questions, and then we'll move on to the following questions.
Sorry, I'm not taking notes. The first question is about what key areas are?
What key areas within the healthcare system do you say need to be bolstered urgently to improve if we're to cope with a second wave of the COVID-19 virus?
Yeah. So look, I mean, the second wave is a real risk as we see the opening up of the economy, which we fully support. As you would have known, that we have supported this from day one. From after the initial 21-day lockdown. We have supported the opening of the economy because our view is that South Africans have endured one of the most devastating economic consequences of this pandemic. We supported the initial lockdown because it was important for us to have that 3 weeks effectively to make sure that we get our health system ready. We were not entirely happy with how the health system was readied in that time, and there were still gaping holes. And so the systems, the things that I think are important for the second wave are the following. And Lindy can come in here from her experience of the of effectively like from her oversights as well. But my view is simple, that we've got to make sure that we bolster a couple of things. Now, one, we've got to make sure that we bolster our public education element of this pandemic, because ultimately we know that the people of South Africa need to be active players and active role players in making sure that we stamp out this virus. And so behavioral change is important. And so government needs to now shift from saying we're building hundreds of field hospitals and ventilators, to making sure that we're shifting now to saying, South Africans, what are some of the behavioral things that you can do to effectively change the situation? Wearing of masks is important, continuing with washing of hands, continuing with making sure that we sanitize and we maintain social distance. And also, even though some of the elements of our economy are now open, it's important that South Africans maintain restraint. So that's the first part. I think that a public education process is very much needed. And then secondly, I think it feeds back to what we spoke about earlier, that effectively we now need to go back to the basics. In our oversight visits across the country, we visited primary healthcare facilities, we visited field hospitals, we visited quarantine facilities, we visited hospitals. And what's now important is that in order for us to deal with the second wave and we deal with it effectively, we need to make sure that we go back to the basics. We need to make sure that we are now immunizing people. We're now making sure people are not missing their chronic medication. We need to make sure that the things that were broken are now fixed. By that, I mean infrastructure projects were halted during this time. Those need to resume quite urgently. In Bizana, when I was there, the COVID-19 patients were being tested for the pandemic in huts. And so, I mean, my view is that in order for us to deal with the second wave, there's behavioral changes that need to happen. We need to make sure that the provincial health systems are not lax and that they still continue really making sure that they are on alert and they've got the necessary resources. But also, we now need to go into the hard yards of ensuring that we start improving this health system from the bottom up. Lindy, is there anything else you would like to add on this question before we move on to the next?
Thank you, Sylvia. Yeah, you know, cool. This is so expansive, and we could talk about this forever. We visited these hospitals. The ANC have told us and said to us in the committee last week that the COVID-19 actually showed us how ready South Africa is for the national health insurance bill. And we were aghast, because what this COVID-19 did was actually show us that without a doubt the health system in South Africa is nowhere near ready for NHI. There's no health system. If you don't have a health system, you can't have an NHI. So there is a sincere desire by them to push through the NHI. And I want to, and by centralizing funds and leaving the current MECs, their cronies, their support bases in place without putting qualified people into positions to understand health, to know health, is a concern. The other major concern we've had, and this will be is highlighted by the corruption, is the AG's report. It was very, very clear that for the last several years, the health system has been collapsing, and most importantly, their financial systems. And what they have highlighted to us, and we've seen this in the COVID situation, is that no attempt whatsoever has been made by any sector in the health system, in any provinces in health in the country. Not one of those areas has done anything to support, improve, or fix their accounting systems. Nobody who is responsible for those failures has been held account, and so there's been no improvement whatsoever. And when this is happening, you're rife for corruption, because if you're not fixing the problems and you're letting these people who have been there for 10 years already go on and on and on, you have a problem. And the NHI is going to exacerbate that system, because you are now centralizing funds. And I just wanted to speak to Lindsay Bentler's question, Lindsay, with regards to we're going to be criticised. The DA is going to be criticised, so because we're going to try and hold up the bill. Well, quite frankly, we're used to being criticised by the ANC, and it's nothing new. And they will use every available excuse that they can to push back at the DA. I think the first thing they're going to say is that we do not care for the poor and the disadvantaged. Well, in actual fact, exactly the opposite is true. It is because we care, it is because the DA cares, that we are going to ensure that these processes are done, that they are done correctly, and that any gaps that are left in the NHI bill are closed, and we go over to a proper, well-established, well-negotiated universal health care coverage. We want that. We want it for all of the people. And it's because of that, and because we care, that we are going to fight to make sure that these kind of things are dealt with. We are so often advised by the ANC-led government. We are so often criticised by the ANC government on bills, on policies, on debates that we have. And yet in the long run, in almost every single instance, the ANC listens, realizes they are at fault, and subtly, or sometimes not so subtly, start to implement the DA's suggestions or policies. So fear of criticism, not at all. if they cared for the people, they would be reassessing this bill and making sure that it was transparent and the process was thorough. We are doing that because we care. Thank you.
Thanks, Lindy. I do want to add on to that because, the criticism, Lindsay, may be that we are trying to filibuster this bill. But that's not the case because, as I've stated before, there've been times throughout history where the courts have ruled that Parliament has been found wanting in its own processes, where bills have been sent back because actually Parliament's own processes were circumvented. And so, no, we are not delaying the process. All we're simply saying is this. South Africans took the time to go to public hearings across the country and to make their voices heard. Yes, there were problems with how those things were designed and how people were participating, and we can have an academic argument, and I think the Chief Whip can, as a project, can look with her other colleagues in Parliament about how do we make sure that public participation is substantive and it is really effective. But over 11,000 people made submissions orally. And currently, Parliament has counted over 62,000 submissions which have been submitted either by hand or by email. Now, I don't know all of the bills in Parliament that have had a public participation process this rigorous. It shows you that the fact that there's been so much engagement with this bill, that South Africans want to be involved in it. And if we were to abdicate our constitutional responsibility and not make sure that we are thorough, then we are letting them down. Then what is the point of people having braved weathers, taken taxis to go to public hearings? What is then the point of entities having compiled documents and gone through the bill in excruciating detail to send us their inputs, if then we simply want to relegate that process to an independent service provider and then not do our jobs, or if then we want to simply rush the process? All we are simply saying to the Speaker, to the Chair of Chairs, and to the Chairperson of the Portfolio Committee is that we are committed to this process, we're committed to working hard, but what we're not going to do is to rush the process for your own political needs, that you want to satisfy your own internal ANC needs. What we are going to do is we want to be thorough with this process so that we can give effect to the wishes of the people of South Africa, and we can make sure that we deliver universal healthcare.
Thank you, Sibiwe. Just a few last questions from the members of the media. Tamar has a follow-up question asking you, Sibiwe, if you could elaborate on your concerns about the NHI Bill and the scope for corruption. What technical weaknesses do you see in the bill, and what needs to be changed to ensure health funding does not leak out the system? Then there's also a question for you, Natasha, from Lindsay. She's asking if you could perhaps elaborate on these unprecedented steps, or what these unprecedented steps may entail to hold those responsible for corruption to account. And then a final question from Vuyo from City Press, who's asking you, Sibiwe, can you perhaps give one or two examples of the exact state of and possible names of the 26 healthcare facilities which you visited during your tour? Yeah, that's it.
Okay, Tash, do you want to go first, and then I will tackle Tamar and Vuyo's question at the same time?
Yeah, Siv, I think in the interest of time, I think that's a good call. Lindsay, some of these unprecedented steps include, but are not restricted anyway, to possible personal actions that we take against individuals. We must remember that there was a COVID command council that did not hold itself accountable to Parliament, and that COVID command council obviously now needs to be held accountable, and we've never seen a grouping of people like that being held accountable. There are possibilities of class actions being brought against those who delved into this kind of immense procurement fraud and corruption. We can hold various ministers personally accountable, which it's not usually done, but we can do so both through Parliament and through private legal facilities if we require that to go that way. But I think core to this and what is unprecedented is we've never dealt with a command council before. And this command council has taken decisions and has extended the Disaster Management Act without consulting with Parliament, which is the decision-making body of the country, and has done so in what we consider to be a most irregular fashion, thus causing themselves to be wholly accountable for problems that have arisen through the COVID crisis. So certainly looking at this particular command council, who sat on it, who knew about the decisions that were being taken. We also need to look very much at the command councils that the Minister of Cooperative Governance attempted to establish in provinces. I gave you some of the examples of things that were going wrong in Gauteng, most especially given the huge numbers there. And certainly individuals will have to account for their role that they played in missing corruption or in fact causing corruption in certain instances. So unprecedented in the terms that we are going to not just let these individuals come and explain themselves and explain why they did things, but there will be possible actual legal action taken against individuals, and certainly possible class actions taken against those, especially that sat on a COVID command council that accounted to no one but themselves.
Thank you, Natasha. So I'm just tackle Tamar's question first. Tamar, yes, so the parallels in my view of what we saw during COVID-19 and what we are likely to see under a centralized NHI fund is exactly this. So the bill in its current form proposes that there be a centralized national fund, a national health insurance fund that will basically pool funds from both the public and the private healthcare sector in order for there to be a rollout of funding or a rollout of health services across the country. Now, what we saw during COVID-19 was almost something that is a prelude to what we would likely see. Because of emergency procurement processes, we saw provinces being able to circumvent some of those procurement processes. We saw them being able to be left to their own devices in terms of being able to issue out contracts. Natasha went through great detail in showing how some of these were not even tax compliant. Some of these were deeply connected to the political elite. And some of these contracts were also people who had never done this before and who were established in March, April of this year. Our big contention, however, is not that there isn't any power in centralizing procurement. Our view is that, of course, big procurement projects can be centralized for the purposes of ease of doing business and also for cheaper procurement prices. But if you look at the model that the NHI Bill proposes, it talks essentially about having an NHI fund that is managed by a board that is essentially appointed by the minister. Big red flag, because what we saw with the COVID corruption was that actually it was politicians who were most to blame for the looting that happened during this time. It was people who were politically connected, either through their family members, their spouses, their children. Esma Khashoggi comes to mind, the issue around Bandile Masuku, the issue around Kusela Diko. All of these things point to an inadequate governance system that doesn't allow for proper checks and balances. Our view is that politicians should be kept away from procurement processes entirely. And good governance principles will confirm that view. And so that is why we're against this model of centralizing this fund. and having a fund that is managed by people who are appointed by a minister. And this is not a direct indictment on the current minister. The golden rule in making legislation is that you must always legislate for the worst possible person to preside over that government. It's not about Dr. Zweli Mkhize personally. It's not about anyone else. It's about making sure that the bill that we pass can withstand even the worst possible members of the executive in the future. And so essentially that is the problem, that politicians have a direct impact on how massive monies are spent in healthcare. And so that is what I was talking about, the centralization of the NHI fund, the fact that there's direct political involvement of politicians in managing of that fund, and that it's not in any way independent. And we saw how politicians, when they get very close to procurement processes, what happens. And then to Vuyo's question, some of the names of the facilities. Vuyo, there were, like Lindy said, there were 26 facilities that we visited across the country. I am more than happy to go through the list with you. But if for the purposes of this question, and perhaps for other colleagues, I mean, some of the facilities that really stood out for me personally, and then that moved me personally, was visiting the Bizana area in the Eastern Cape, the Mount Aleph Hospital in Alfred Nzo district, where I spent their day with the local leadership there, and I visited 3 hospitals in that area. And really, you know, that is the one area where I can say infrastructure backlogs are a massive issue. There were rondavels. And I grew up in a village. I know exactly what rondavels are like. There were rondavels that were being used to test patients for COVID-19. Now, that is just unconscionable, because how is it that an established healthcare facility does not have areas where people can be with dignity tested for a virus, but also making sure that essentially infection control is under control by moving them from one area to the next and to treatment without making sure that they infect others. In that very same province, there were issues, like I said, in Alfred Nzo district, there was not a single critical care bed in that district, which means that people had to travel hundreds of kilometers to Mthatha General in order for them to get critical care if they needed it. And so that's a massive, massive, massive indictment. And then, of course, I mean, I visited other provinces. I visited Mpumalanga, I visited the Northwest, and the last stop that I made was in the Free State and in the Northern Cape. And one of the things that I think I'll take out from the Northern Cape particularly is, of course, the province has had very low numbers of infections, and it's unclear whether or not they will get a peak more than that they have. But ultimately, that visit underscored to me how we need to develop our health system in a far more effective and efficient way, because there were dedicated healthcare workers that I met there, particularly who are working in that billions of rands or worth of the mental health hospital. But there were issues where here is a massive hospital that has taken 14 years to build, that has now cost the taxpayer billions of rands, and that sits as a white elephant, while the province is in desperate need of mental health care services. And going to Berkeley East, Berkeley West, that is a deeply rural area there. And there's one district hospital that services areas that are 200 kilometers away from it, and where people have to have mobile clinics taken to them once a month. Again, Vuyo, I think for me, it underscores the need that when we are now legislating in Parliament in the coming weeks, we've got to understand the true extent of our health system and the true brokenness of our health system. And we've got to make sure that we fix those things and we deliver healthcare that is underscored by dignity. And that is my thing, because there can be no dignity when, it's either I get onto a scooter that has been afforded to me by the Eastern Cape Department of Health, or a wheelbarrow. The choice between the two shouldn't be a choice at all. And so, yeah, that is my comment on that.
Thank you, Siviwe. I'm just checking to see if there are any final questions. If there isn't, then I think we can conclude this press conference. I don't see any further questions, Siviwe.
Cool. Thank you very, very much, colleagues. And I'm more than happy, and other colleagues, I'm more than happy to make a list, a physical list of the 26 healthcare facilities that we visited. And provide that to you, or attach it to the statement that will go out. And thank you very, very much, colleagues. We will obviously now, the process now is over through to Parliament. We will be meeting as a portfolio committee in the next week or so for us to, as we've said, Lindy and myself will be fighting very hard to make sure that the terms of reference for this external service provider are ones where they are only limited to process and logistical support, and not the substantive deliberations on what South Africans have given us. And we will make sure that this process is thorough. And so we will keep you updated as the process proceeds in the next coming months.
All right, thank you everyone for joining. We really do appreciate it. Goodbye.
Bye, everyone. Stay safe.
Bye all. Thank you.